The early data in these studies can be really encouraging, but it doesn't necessarily represent the truth. And the way you get to that is with bigger trials. Now, with the field moving so fast, it's really important to get very rapid trial enrollment and very rapid trial data. And the way that that sometimes works out is having a lot of that data done in one country, where it's like, okay, well, in that one country, this is what we have from the early data. And sometimes that's not going to translate to globally what that looks like. At the same time, when you have these big global trials, say, okay, well, those outcomes, they don't necessarily translate specifically to what's happening in one country either. And each country has its own systems with its own benefits and flaws, certainly. And the challenge, I guess, is as an oncologist taking that population level data and distilling down to where that matters for an individual. But to more specifically answer your question, as we see these early stage trials, I think we get kind of a directional, does this look like it works? What is the general kind of side effect? And then we really have to see in the bigger trials where half of patients get that, what we call study drug, and half of patients get the standard of care. And just to specify, nobody is getting just placebo. I know that's a common concern from patients about going into a trial, is that they risk, but that's not what happens. Everybody gets the best therapy we know of, but the trials often have half of patients get what we call study drug. But this is important to understand because right now, these clinical trials, I think in many cases are really great opportunities for patients. It's important that patients are aware of these different trials because, in some scenarios, these are so promising that I think they represent a better treatment opportunity than some of the standard of care options as well. So for anyone watching this who, has or knows someone with small cell lung cancer, I think getting an evaluation at a center where they're running a lot of these trials is really important, not just something for future patients, but for you. This treatment hopefully works for you and then goes on to help other people. But enrolling in a clinical trial is all about what's the best option for you.